Congratulations, and thank you for choosing Beaches OBGYN. At this point, you most likely have met your primary provider. In general, your primary obstetrician is the doctor who confirmed your pregnancy or who was your usual provider before the pregnancy. That provider will see you most often as your due date approaches. During your pregnancy, you'll also rotate meeting the other doctors in our practice. This provides an opportunity to meet all the doctors in our practice who could possibly be taking care of you in the hospital during labor and delivery. By the end of your prenatal care, Dr. Manik, Dr. Patel, Dr. Peter, and Dr. Rodriguez will hopefully be familiar faces to you. One of the members of this team will be available for you 24/7 when it comes time to deliver your baby. We deliver babies at Baptist Medical Center Beaches, which is conveniently located right next door to our office in Jacksonville Beach. We are always available for you. During regular business hours, you can call 904-241-9775 and press option 1. One of our staff members will answer the call and help you with any needs you may have. You can also text us at 904-441-6725. This will connect you with our secure messaging service, Clara. This messenger service can also be found on our website at beachesobgyn.com. Please know that this service is not intended for emergencies and is monitored only during regular business hours. For life-threatening emergencies, please call 911. For urgent matters, or if you think you may be in labor, please call us instead. Outside regular business hours, our main number, 904-241-9775, is connected to an answering service. If there is an urgent need, our on-call doctor will be immediately paged to assist you. Your first visit or confirmation of pregnancy. When you called us to confirm a positive pregnancy test, our staff may have asked you for the date of your last menstrual period. This date is used to calculate your expected due date, or EDD. Establishing this date as accurately as possible is important because the timing of many aspects of prenatal care will be based on your EDD. Please know that this date is not exact and can change based on multiple factors. Once we have a due date, your first appointment with a doctor will in general be between 7 and 8 weeks of gestation. Of course, if you have any problems before your scheduled visit, we can accommodate for an earlier appointment. During this first visit, your doctor will confirm the dates and viability of your pregnancy by performing an ultrasound. We will also identify any specific risk factors that may need early intervention or treatment. After this initial visit, you will return for multiple visits. Until 30 weeks of gestation, we will see you every 4 weeks. From weeks 32 to 36, we will see you every 2 weeks. In the last month of your full-term pregnancy, visit frequency will be weekly. Your new OB visit. This visit usually happens around the 12th week of gestation. This will be a longer visit and often involves a first trimester ultrasound. If your pregnancy was identified as being high risk during your confirmation appointment, the first trimester ultrasound may be performed by a maternal and fetal medicine specialist. These specialists will co-manage your pregnancy with our doctors. During this visit, the provider will review your medical history, order lab work, and perform a physical exam. Routine labs. Most of the routine labs will be ordered in your new OB appointment. These labs include blood type, testing for anemia, testing for infections that can be harmful to the pregnancy, such as HIV, hepatitis B and C, and syphilis. We also recommend to screen for maternal genetic conditions like cystic fibrosis and spinal muscular atrophy. During the new OB appointment, we will also discuss and order genetic testing if so desired by the patient. At around the 18th week of your pregnancy, screening for spina bifida and abdominal wall defects will be ordered. This test is called serum alpha fetoprotein. The next set of labs will not be due until around 26 weeks of gestation. At that time, all patients get screened for gestational diabetes and are again tested for anemia. For most patients, this will conclude all blood work requirements for the pregnancy. The last routine test is the Group B strep culture. This is a culture for a common bacteria found in the genital and anal area. Although GBS is not considered an infection for mothers, it can cause infections in newborns if transmitted at birth. Genetic testing. There are two types of genetic testing: maternal DNA testing and fetal genetic testing. Maternal genetic testing involves testing your blood to see if you are a carrier of certain recessive hereditary conditions like cystic fibrosis, sickle cell, and spinal muscular atrophy. When the mother is a carrier of any of these conditions, we will recommend the father of the baby to be tested. This is because your baby can only be affected by these conditions if both the mother and father are carriers. We also offer fetal genetic testing. These blood tests can identify babies that might be at higher risk of chromosomal abnormalities like Down syndrome. In most cases, the result will provide reassurance that the chance of your baby to be affected by these conditions is extremely low. Ultrasounds. During the confirmation visit, which typically happens between 6 and 8 weeks, all patients will have an ultrasound. This ultrasound confirms the location of the pregnancy and, most importantly, helps establish your due date. The next ultrasound is performed between week 12 and 14. This first trimester study could provide an early indication of chromosomal or cardiovascular fetal abnormalities. At around 18 weeks, a third ultrasound will be performed. This ultrasound allows evaluation of your baby's anatomy. You will also be able to find out the gender of your baby if you wish. Many low-risk patients will not need any additional ultrasounds. Having said that, it's not uncommon for patients to need additional ultrasounds to monitor the baby's growth later in pregnancy. Exercise during pregnancy. Exercise during an uncomplicated pregnancy is safe for you and your baby if you follow some simple guidelines. With exercise, you should not let yourself get overheated or out of breath. Do not push yourself to the point of being lightheaded or unable to hold a conversation. Keep exercise at a moderate level. Contact sports that put you at risk of getting hit in the abdomen should also be avoided. If you were already exercising regularly before your pregnancy, you can usually continue your exercise program with the above modifications. Diet during pregnancy. Healthy eating during pregnancy is critical to your baby's growth and development. In order to get the nutrients you need, you must eat from a variety of food groups, including fruits and vegetables, breads and grains, protein sources, and dairy products. Typically, you will need to consume an extra 300 calories a day starting in the second trimester. It is normal to gain weight during pregnancy. The recommended amount of weight gain depends on your pre-pregnancy weight. If you were underweight before the start of your pregnancy, the expected weight gain is between 25 and 40 pounds. For patients with a normal pre-pregnancy weight, the recommended weight gain is 25 to 35 pounds. When the pre-pregnancy weight is higher than normal, the weight gain should be lower. It is also important to remember some foods and beverages that should be avoided during pregnancy. During the first trimester, caffeine intake should be kept to a minimum. If caffeine is consumed, the total daily amount should be less than 200 milligrams. Alcohol should not be consumed during pregnancy in any amount. Avoid eating raw or undercooked meat and fish. Eating undercooked food may increase the chance of infection with Listeria, E. coli, and other viruses and bacteria that can be harmful to both you and your baby. Also avoid unpasteurized dairy products. Fish is a healthy source of protein in pregnancy. Nevertheless, some fish like shark, swordfish, and marlin can have unhealthy levels of mercury. Before eating fish, check that the one you are consuming is considered safe and has low mercury levels. Labor. During your prenatal appointments, your doctor will remind you of the main reasons you should call us no matter what time of the day. These reasons are, number 1, contractions every 5 minutes for more than an hour. Number 2, bright red vaginal bleeding with or without contractions. Number 3, decreased fetal movement, less than 10 movements in 2 hours. And number 4, if your water breaks with or without contractions. For these urgent matters, always call our main office phone number, 904-241-9775. During regular business hours, please press option 1. After hours, you will communicate with the answering service. If told to go to the hospital, the team at the hospital will be expecting you. Please proceed to the dedicated maternity entrance of Baptist Medical Center Beaches. We hope that this video has provided you with a quick overview of what to expect during your prenatal care. Please feel free to ask your doctors or staff any questions that may arise during your visits or pregnancy. We are so glad to have you as a patient of our practice and look forward to being by your side in this exciting journey.